details of week number 1 and 2. We got a question asking, what is the false statement regarding the first week of development? Sperms are going to fertilize ovum, that's correct. And zona pellucida is acellular, yes it is glycoprotein, acellular membrane. Marula 16 cell stage, usually 16. And blastocyst is attaching to endometrium, but day number 6. So this is a wrong statement which you have to elaborate further. You will see that this is the ovary undergoing ovulation and giving us secondary oocyte, which will be coming to the ampulla of fallopian tube, fertilized there and forming zygote, which is 2 nuclei. On day number 2, you will have 2 cell stage. Day number 3 is morula multicellular stage, maybe 16. And day number 4, the conceptor center uterine cavity, and that is called as the advanced morula. So day number 4, when the conceptus enters the uterine cavity, this is the advanced morula. It is more than 16 cell stage, and then it will be becoming blastocyst by day number 5, and then this blastocyst is going to attach to the endometrium day number 6. So it is attaching to endometrium day number 6. This is the diagram which we are supposed to draw now. So let us draw the diagram of the uterus here, and this is the uterine tube, and then we have the ovary here which is undergoing ovulation. So as the ovary is undergoing ovulation, the cell which is found there is called as the secondary oocyte. The secondary oocyte which is undergoing ovulation is covered by a glycoprotein membrane, and that glycoprotein membrane is called as the zona pellucida. Now this zona pellucida, as you see, is a cellular structure to attract the sperm. As it is attracting the sperm, that will be helping in fertilization, which occurs in the ampulla of the fallopian tube. So there you can see this structure which is in the ampulla of the fallopian tube. That is where the fertilization is happening. You notice that this is the zygote seen after fertilization and is still covered by zona pellucida. So the fertilization occurs in the ampulla of the fallopian tube, and is the zygote which is still covered by zona pellucida. The zona pellucida is preventing 2 things. Number 1, it is preventing the abnormal implantation, because implantation should happen in the uterine cavity. And number 2, it is preventing polyspermy. So zona pellucida is preventing polyspermy and it is preventing implantation. This is day 1 of life, zygote, a single cell structure. Now if you say this is the zygote, a single cell structure, this is day number 1 of life. So day number 1 you have single cell, day number 2 you will have 2 cell, and day number 3 will have multicellular stage, which is called as the morula. Day number 1 you have single cell stage, and day number 2 of life you have 2 cell stage. Day number 3 you have multicellular stage, which is called morula. Morula generally taken as 16 cell stage. Now when you say morula is 16 cell stage, understand more than 16 cell stage, which is called as the advanced morula here. This is the day number 4, and it is called advanced morula, which is day number 4. There will be one advanced morula which is more than 16 cell stage, enters the uterine cavity, and then it will change into what is called as blastocyst. Now this is the blastocyst, which will be seen on day number 4, by the end of day number 4. Blastocyst is having some blast cells and a cyst-like cavity. So this is the day number 4, by the end of day number 4, you are having the blastocyst with some blast cell and cyst-like cavity still covered by zona pellucida, preventing implantation. But then you have to lose the zona pellucida because you want to attach to endometrium, and that will happen on day number 5. So it is day number 5 that the blastocyst will be hatching out of zona pellucida. Now, as it is hatching out of zona pellucida, day number 6, it will be attaching to endometrium. So day number 6, blastocyst attaches to endometrium. That is what we have to remember. See, this is a timeline which you are talking about, and as you can see, what you find is day number 1, single cell stage, day number 2, two cell stage, day number 3, multicellular stage, and day number 4, 5, 6, it is the blastocyst. Day number 4, blastocyst is found by the end of day number 4. Day number 5, it is hatching out of zona pellucida. Day number 6 will be attaching to the endometrium. And also remember, the implantation is a week-long process. Now, if you say implantation is a week-long process, when does it begin? Day number 5. And when it is finishing? Day number 12. So you mean to say that implantation has begun when the blastocyst was hatching out of zona pellucida? Yes. And completed on day number 12. Though some books will say 5 to 7 days. Some will say 7 to 9 days. So 5 to 7, 7 to 9, but it is 5 to 12. And also remember that day number 12, when the implantation is completed, the uterine, this is going to be the fetal placental circulation. The fetal placental circulation is to be established later. Now, if you say the fetal placental circulation is to be established later, what is established right now? See, in the beginning, the conceptus is depending upon diffusion, but at day number 12, maternal placenta will have blood, which is called as the uteroplacental circulation beginning. So, uteroplacental circulation begins day number 12, and the fetal placental circulation begins a bit later, day number 17. Understand, day number 12 is the uterine placental circulation established. Uterine placenta, because placenta has two parts, uterine placenta and fetal placenta. So uterine placental or the uteroplacental circulation is beginning at day number 12, but the fetal placenta circulation will be beginning at day number 17. We will draw a diagram for that as well later. This is the question we were focusing upon, as you can make out. Spermatozoa is fertilizing ovum, of course. And zona pellucida acellular, it is a glycoprotein membrane, acellular membrane to attract the sperm. And more or less 16 cells? Yes, it is. But the blastocyst is attaching to endometrium. See, this is your false statement. That is your answer because it is not day number 4, it is day number 6. That's what you have to remember. Now, as you are talking more about implantation, let's magnify the diagram of this area because we have to discuss what is happening after blastocyst stage. This is going to be a detailed structure. Let us still magnify it. As you find, this is the morula which has entered the uterine cavity. Advanced morula, more than 16 cell stage attaching to endometrium. You will see that that was day number 4. But by the end of day number 4, you will have blastocyst formed. It is called blastocyst because it has some blast cell and cyst-like cavity, blastocyst. There will be an inner cell mass and outer cell mass. Outer cell mass is trophoblast, which is going to form placenta. And inner cell mass is the one which is called embryoblast, going to form embryo. Actually, it is the cytotrophoblast which is giving a syncytiotrophoblast which will help in attaching to the endometrium. And then you will also notice that the inner cell mass is dividing the two cells. What are the two cells the trophoblast is giving? Cytotrophoblast and syncytiotrophoblast. That is the, see, if it is going towards the endometrium, helping in penetration was syncytioblast, and the one which is cellular stage is called cytotrophoblast. They actually form placenta, basically. In the inner cell mass, there are two types of cells which we are talking about. You see, there will be a dorsal cell, epiblast, and a ventral cell, hypoblast. Let us talk more about the epiblast, hypoblast, which came from the inner cell mass, and the cytotrophoblast and syncytioblast, which came from the trophoblast. This is the implantation going on. So let us begin with the blastocyst. See, blastocyst is called as blastocyst because it has blast cell and a cyst-like cavity. There is a outer cell mass which is called as the trophoblast. Tropho means nutrition. It is going to help in formation of placenta. And then there's embryoblast, which is going to form the embryo, and by dividing into two types of cells. Namely, you see here, as we are talking about week number 2, it is the week of 2. There will be two types of trophoblast, two types of embryoblast, and there are two cavities also. What are they? Notice there is a dorsal amniotic cavity and ventral yolk sac cavity. And the two cells, dorsal epiblast and ventral hypoblast. Both of them came from the embryoblast. And what about the trophoblast you were talking about? Trophoblast, if you say, trophoblast is two types, as you can make out. Syncytiotrophoblast towards the periphery and cytotrophoblast here. Formed when? It is week number 2. And same time when the embryoblast has formed epi and hypoblast. Dorsal cavity, amniotic cavity. Ventral is yolk sac cavity. Week number 2 is the week of 2, as you say.